Hey, what's up everybody? Dr. Ryan Weaver here with Apex Spinal Performance's Spinal Workshop. Today we're going to be talking about headaches. That is our topic of discussion. This is one that we have done a lot of previous spinal workshops on. We're going to throw some new things at you, really some statistics about rebound headaches and taking medication for those and how that happens. So again, do us a favor, go ahead and share this link, comment on the page. Like us on YouTube, subscribe to us so you can get all the notifications. I'm really excited for the future year here planned out of topics and also some things that we're going to do differently on here. So let's dive into this. But headaches are one of the most prevalent pain disorders worldwide. 50% is the statistic on that. So when you look at worldwide prevalence in pain, how many people actually experience these, but also how many ER visits. In the United States alone, headaches are the 5th most common cause for someone to get a headache and go to the ER, 5 million annual visits in America to the ER for a headache. So think about this. Think about your loved ones, your friends, your family, co-workers. How many times have they ever experienced a headache? It probably happens more often than you think or than you're aware of. Migraine headaches specifically are the most frequent type to the ER. $17 billion annual direct and indirect cost to the United States. So I mentioned coworkers or even employers. How much of lost productivity, but also happiness and joy, because I don't know about you, but if you've ever had a headache, most of the time you aren't happy and joyful when you have it. So how those things really affect the workplace, how those things, if you're a parent, affect your family, your kids, your significant other. There are a lot of direct and indirect costs, not just from a financial burden, but also who suffers from those. So from the Mayo Clinic, risk factors for frequent headaches. I've got to kind of chuckle at the last one here. But female, so it's more prevalent in females. Anxiety, depression, obesity, and sleep disturbances. Snoring, overuse of caffeine, overuse of headache medications, which we're going to talk about here a lot more in depth in just a moment. And then the last one I said I kind of chuckled at, other chronic conditions. What in the world does that mean? Everything under the sun could be classified as that if it's something that you've experienced. So it's kind of a catch-all risk factor there. So sticking with the Mayo Clinic here, tension headaches are the most common headache. Causes aren't well understood. What the Mayo Clinic has recommended for treatment is a balance of healthy habits and non-drug treatment. So you have it right from the Mayo Clinic. Treatment, balance healthy habits, and non-drug treatment. Harvard, throw this into the mix. Exact cause of headaches unknown. So Mayo Clinic and Harvard, we don't know why they're happening. Harvard, the same paper, impact of headaches is how the nerves of the head, neck, and shoulder sense pain was their best guess there. Medications for treatment, if you take no more than 2 to 3 times a week. Okay, so if you take more of this could end up with the number one side effect of most headache medications is what's called a rebound headache. So if you think about that, if you have more than 9 times in a month, 8 to 9 times that you take aspirin, ibuprofen, Tylenol, any other headache medication, then you could end up with a rebound headache, which the severity, okay, again, Mayo Clinic here, medication overuse headache. This type of headache usually develops in people who have an episodic headache disorder, usually a migraine or tension type, and take too much pain medication. If you're taking pain medication, even over the counter, again, the things that I mentioned there, you're at a risk of developing a rebound headache. Medication overuse can increase the severity, how bad the headache is, and the frequency, how often. So you started with maybe 2 headaches a week. We continued up with over-the-counter medications that's actually doubled that, made it worse, or made them even worse in intensity. So, again, medication overuse, any headache medication over than 2 times a week is considered overuse. The National Institute of Neurologic Disorders and Stroke. Headaches are the most common form of pain and major reasons cited for missed days at work. So back up to one of the first things that we talked about, who all this affects, even at the workplace, but it's the most common form of pain that basically has us missing work or missing school or such events like that. How many types of headaches are there? Well, most common we talk about migraines, tension headaches, cluster headaches would be in there as well. But the International Headache Society stated that there are over 150 types of headaches. So you hear me talking about over-the-counter, ibuprofen, NSAIDs, things and such. But what are some of the other treatments? So I really dive into these because I can't believe these are some of the ones that they use, but anticonvulsants, antipsychotics, antidepressants, Botox, triptans, calcium channel blockers, oxygen therapy, probably one of the things you'll get if you go to the ER for such a headache, and non-invasive nerve stimulation. So, again, I go with Mayo Clinic, healthy habits, non-drug treatments. One of the themes from 2023 that we talked about, the number one cause of death in our country is poorly made choices. Healthy habits. Make those, we have a better quality of life. From MedLink Neurology, 2017 article here, most commonly prescribed pain relieving medications list headaches as the top side effect. So again, I mentioned that earlier. Chiropractic care has the ability to reduce both the intensity and duration of tension headaches. Tension headaches are often a result of stress or bad posture. So again, in previous headache talks, we've talked about the cervical curve. Proper posture helps alleviate the pressure and tension on our spine, indirectly our nerves. Release the stress and reduce these kinds of headaches with chiropractic care. This was a 2010 article from JMPT. So how about some of the other holistic treatments? We talk about essential oils, supplements, and things like that. So in terms of the essential oil, lavender and peppermint oil, those have been known to help improve headache symptoms. Ginger, so if you have nausea, more probably with the migraine, ginger has been known to help with nausea. Magnesium, again, helps with migraines and also menstrual cycle-related migraines. Magnesium is commonly found in nuts and seeds. A few of the other ones, make sure you're adequately hydrated. Exercise. Feverfew, B-complex. The B-complex actually helps regulate neurotransmitters. And then butterbur could also be something to look into. So I want to educate you on what is most commonly used in the medical field and what you hear of, and some of the side effects of those things, why headaches happen, and how we can improve those through non-drug related treatments. But remember this, pain is often a symptom. It's a light on our dashboard of our vehicle saying something isn't working as best as it can. Something is wrong. So instead of just masking it with a medication or continuing every single day to take ibuprofen or Tylenol or such, have that checked, have your spine checked, make sure the curves in your spine are intact and how they should be, or if there's any things in terms of healthy habits that you need to review and help make better decisions. So I hope you found this spinal workshop informative, and we'll look forward to seeing you here at our next spinal workshop. Take care, guys. Have a great evening.